Okay, I think we are live now. Okay, everyone, welcome. I call this meeting to order. This is the regular board meeting of the Board of Trustees of the Canutillo Independent School District. Today's October 27th, 2020. The time is 3:06 p.m. And before we start, I want to read the disclosure with respect to the meeting. On March 16th, Governor Greg Abbott granted a request by Attorney General Ken Paxton to temporarily suspend a limited number of open meetings laws to the extent necessary to allow telephonic or video conference meeting in response to the coronavirus COVID-19 pandemic. In accordance with those suspended rules, we certify the following. Notice of this meeting has been posted online for at least 72 hours. Although members of the board are not gathered in a central physical location, we do have a quorum in attendance at this meeting by telephone call and internet access. We are meeting by use of both telephone conference call, online access, and through the use of an email link for questions. If a member of the public submitted written comments in advance, the board president or a member of the administration will read the comments into the record before or during the board's consideration of that item. If you would like to provide comment at a future meeting conducted by video conference or telephone call, please follow instructions on the meeting notice. All other meeting procedures will adhere to board adopted procedures to the extent practicable. An audio recording of this meeting is being made and will be available to the public at a later date. We apologize in advance for these difficulties and ask for your patience as we navigate again through these conditions. And if you have questions about these suspended laws, please contact the Office of the Attorney General at 888-672-6787 or by email at TOMA@oag.texas.gov. All right. With that, the next item of the agenda is the Pledge of Allegiance. If everybody will please stand, and Ms. Trout, would you please lead us for the United States Pledge of Allegiance to the flag?
Yes, sir.
And Ms. Brigham, will you join us in leading us for the Texas pledge? All right, go ahead.
I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I lost my contact.
Are you there? We can hear you. We can hear you, Ms. Brigham.
Okay. I'm sorry. Sorry, everybody.
That's okay.
Okay, my brain went blank. Everyone
Okay.
help me.
Honor the Texas flag. I pledge allegiance to the Texas, one state, under God, one and indivisible.
Thank you all very much.
Thank you,
You're welcome.
Trout and Ms. Brigham. All right, that takes us to the agenda item, and that will be the roll call. Stephanie, are you there?
Yes.
All right.
Ms. Brigham,
Present.
Mr. Coronado,
Here.
Mr. Payan,
Here.
Mr. Rodriguez,
Present.
Mrs. Searles. Here. Mrs. Trout.
Present.
Item E, CISD Vision and Mission Statement.
All right, and Mr. Rodriguez and Mr. Payan, would you do the honors for us, please?
I'll do the vision. Canutillo is a premier district preparing tomorrow's best today with innovative, future-focused learning opportunities for every student.
Thank you, Mr. Payan, and thank you, Mr. Chair. Our mission statement. Our mission is to create a rigorous student-centered classrooms which develop future-ready students to compete in a global economy and thrive in a multicultural world.
All right.
Thank you.
Thank you both. All right, that takes us to the next agenda item, open forum. Stephanie, do we have, or Dr. Galaviz, do we have any open forum comments that we need to read into the record?
Yes, sir. We have three.
Okay,
Go ahead, Miss Liza.
Hi, good afternoon, everyone. Stephanie, do I go ahead or do you need to read
Yes,
the?
let me read. Any member of the community wishing to make a comment during open forum can send their comments to the following email address: boardquestions@canotillo-isd.org. Comments must be submitted prior to the meeting start time.
Okay, thank you.
Right.
First comment from Valerie Martin, and I will read it now. Dear members of the school board, I am the daughter of two teachers, both of which work for Canotillo ISD, and I have some concerns about their health and safety. It is my understanding that Canotillo has decided to open schools for in-person classes despite the high volume of COVID-19 cases. It may be true that COVID-19 does not pose a substantial threat to children and young adults, but it can be deadly for older individuals, especially those with pre-existing conditions. Many teachers fall into this category of individuals at risk for severe COVID-19 complications, including my parents. Regardless, my parents have been asked to return to work with insufficient protection. We have already had 2 COVID scares with my dad. I understand the pressure to return to school and the difficult situation Canotillo was in when they decided to reopen. However, it seems that the burden of reopening is falling disproportionately on teachers. This is evident in the school board meetings are being held virtually. It seems that it is not safe enough for the school board members to meet in person, but it is safe enough for students and teachers to meet in person. I choose to believe that there was no ill intention when these decisions were made. However, regardless of intent, teachers are being put at an unreasonable risk. What does Canotillo plan to do to protect teachers and staff that are being exposed to COVID? Is there a plan in place for teachers who contract the virus? Is Canotillo willing to take responsibility for teachers who develop serious COVID complications directly related to the decision to commence in-person classes? I do not currently feel that the health and safety of my family is being respected by Canotillo administrators, and I want to know what is being done to ensure the safety of the Canotillo community. Thank you.
all right. And while we can't respond to these comments, it does relate to agenda item 4A1. So we can take up those comments at that time as well, related to that agenda item.
Okay.
Next one.
Next one from Mr. Jesus Ramos, Canotillo ISD School Board. Good evening, board members. I would like to start off by thanking you for your service and dedication to the Canotillo community during these unprecedented times. As we know, earlier this year, TEA waived the 1920 STAR test as a result of the educational disruptions caused by the pandemic of COVID-19. This academic year has not been any different. Our city is the epicenter of the coronavirus. Families are grieving. Many are frustrated by the circumstances in which we must live through this pandemic. The amount of stress generated by the effects of this pandemic and schoolwork has become unbearable. I respectfully ask that as the Canotillo ISD School Board, you follow the steps of the Texas State Board of Education Representative, Georgina Cecilia Perez, and that you petition for the waiver of the administration of the STAR, TELPAS, and all the end of course assessments for the 2021 school year from the Governor of Texas, Greg Abbott, and the TEA Commissioner, Mike Morath. I would also respectfully ask that you adopt the homework freeze imposed by the El Paso Independent School District, and if possible, to petition for this waiver of homework to the officials mentioned above. I hope that you understand the circumstances which our students facing as you advocate for the students of Canotillo. Once again, thank you for your service and leadership through these unprecedented times. Respectfully, Jesus Ramos, community advocate and activist.
All right, we thank Mr. Ramos and Ms. Martin. That is also kind of related to 4A1. We kind of respond to this one, but we can certainly take up this comments from the board with related to that agenda item. Next.
Okay, and this one is from Brandon Yanez. Good afternoon, President Coronado, school board trustees, and Dr. Galaviz. Thank you for allowing me to speak to you about Family, Career, and Community Leaders of America, or FCCLA. I am the current Region 1 Vice President of Membership for the Texas chapter of FCCLA. It is a nonprofit national career and technical student organization for young men and women in family and consumer sciences education in public and private school. FCCLA offers intracurricular resources and opportunities for students to pursue careers that support families. Since 1945, FCCLA members have been making a difference in their families, careers, and communities by addressing important personal, work, and societal issues through family and consumer sciences education. Today, more than 182,000 members from 5,253 chapters are active in a network of associations in 48 states, including Puerto Rico and the Virgin Islands. The work of FCCLA helps students and teachers focus on a variety of youth concerns, including parenting, family relationships, substance abuse, peer pressure, sustainability, nutrition and fitness, teen violence, and career preparation in 4 specific career pathways. These pathways are hospitality and tourism, human services, education and training, visual arts, and design. Involvement in FCCLA offers members the opportunity to expand their leadership, potential, and develop skills for life such as planning, goal setting, problem solving, decision making, and interpersonal communication that are necessary in the home and workplace. Canutillo FCCLA has made a name for ourselves in the national spotlight. We have successfully competed with teams from around the country for the last 4 years. In the last 3 years, we have sent a hospitality, tourism, and recreation star event team to compete. We have dominated the last 2 years in a row by taking first place in the nation. Also, this will be the 3rd year in a row that we have a regional officer, to include myself. This is important because we have encouraged other Region 19 schools to open and increase chapter membership, as well as competition teams. For example, we hosted a local cupcake battle to assist members competing at FCCLA. Hanks High School attended and took 1st and 2nd place at Region 1 competition. Further, we have worked closely with FCCLA chapter at Coronado High School, who advanced to nationals with us this year. All in all, Canutillo FCCLA is a vital CTSO on campus and in our community that provides leadership opportunities for all students. Thank you once again for allowing me to present this to you all today.
All right, thank you, Liza, and thank you, Mr. Yanez, for his comments.
And that is all that we have for open forum.
All right, thank you, Liza.
You're welcome.
Let's take the next agenda item.
Item 3, public hearing regarding the Canutillo ISD Financial Integrity Rating System of Texas. First.
Okay.
A, consider approval of the Canutillo ISD Financial Integrity Rating System of first.
I can't hear her.
Yes, you keep going in and out. Can you read it again, please?
Yes, sorry. Public hearing regarding the Canutillo ISD Financial Integrity Rating System of Texas. A, consider approval of the Canutillo ISD Financial Integrity Rating System of Texas.
All right, administration.
But we have some public to provide some comments, Mr. Chairman.
Sure.
You want to go over the presentation and then
Yes.
have the public? Or do you-
Yes, sir.
Let's do the presentation first,
Sure.
then we can take comments from the board
Okay.
and public comments from the public. Have we had any public comments submitted yet?
I haven't seen any. Miss Liza?
Liza?
I'll find out. Go ahead, Miss Polly.
Dr. Gutierrez, I'm sorry, no public comment yet.
Okay, thank you. Ms. Pulley?
Good afternoon. Good to see you all. Good afternoon, President Coronado, board members, Dr. Galaviz. I come before you to present to you our 2020 first rating. This rating is based on our fiscal year 19 financial data. And the primary purpose of our first rating, well, first, to give you a little bit of background on first, first represents the Financial Integrity Rating System of Texas. And what it basically gives us is our report card on our financial status. It evaluates our performance and the management of our school district financial resources. Part of this rating, if we could move a little forward on the presentation, one more slide. So the first rating was first implemented in 1999, and it covers, like I mentioned before, the rating for 2020 is based on data from the fiscal year 19, which is July 1st of 2018 through 2019. And it's based on information on staff and student data, as well as budgetary and actual financial data and the results of that. Next slide, please. So why is our first rating important? Not only does it evaluate the management of our financial resources for the district, but it also plays an integral part in the accreditation status of the district. Next slide, please. The rating has remained relatively unchanged. The last change that was made was in 2007, in which the rating system, they added 5 required disclosures to the rating system. Next slide. So our ratings are issued, our preliminary ratings are usually issued around August or so, early August. And we have 30 days in which, once we get our preliminary ratings, to evaluate them. If we find any discrepancies or something that we may not quite agree with, we do have 30 days to appeal. If not, our rating does become official 30 days later, which was on September 6th of 2020. The rating is made up of 15 indicators, 5 which are critical. These are either we pass or we don't pass. If we fail any of these 5 critical indicators, we will automatically fail the first. And we will receive a rating of an F, which is substandard. The rest of the ratings are based on a 10-point scale. Next slide, please. So the ratings are based just like a report card. 90 to 100 is superior, 80 to 89 is above standard, 60 to 79 is a C, and less than 60 points would be an F rating. And like I had mentioned before, there are the 15 indicators, the first 5 which are critical. The 6 indicators are based on solvency of the district. And the other 4 are based on the financial competence of the district. Next slide, please. So I'm not going to go through each indicator. I know that they were you have received the presentation, but I would like to address we do have 2 indicators in which we did not receive the full points for. We did pass all 5 of our critical indicators. And the first indicator which we did not receive our full points for was number 7, which is a solvency indicator. Number 7 was the measure of current assets to current liabilities ratio for the school district sufficient to cover short-term debt. So this is saying is our current assets, which is our assets that are we can easily liquidate, such as our cash and investments. Is the ratio of those assets to our current liabilities, and current liabilities means all our liabilities that come due within 1 year. In order to obtain our full 10 points, we would need to have a ratio of 1 to 3. And we are very close at that. We got a 2.856%, so that gave us 8 points. In order to obtain the maximum 10 points, we would either need to increase our cash, basically, by 2.1 million, or reduce our liabilities by 700,000 in order to get those full 10 points. The next indicator that we did not receive the full points on is number 11. See if we can advance to number 11. So number 11 is our admin cost ratio. We received, our admin cost ratio was a 10.53, and we received 8 points. So we are very close. I do anticipate that we will receive the full 10 points for this upcoming rating, I have estimated it to come in at 8.9%. So I do anticipate receiving the full 10 points on our rating for 2021. And if we could advance. And so just to give you a little bit of background on the administrative cost ratio, the next slide evaluates our region, the ratios within the region. Of course, the higher school, the larger school districts, it's a little bit easier for them to obtain the admin cost ratio because of course, the size. It's a lot more difficult in smaller districts to be able to obtain their full points on the admin cost ratio. Next slide, please. One more. This slide shows our comparison to other districts of our relatively the same size as us. And next, one more. And this is we obtained like I said, we did obtain the full points on the rest of the indicators, so we can advance a little bit past the 15. Okay, and so just to let you know that we did score 96 out of 100, which is a rating, and it's a superior rating. And the next slide gives us our ratings for the past 10 years. So we have achieved that superior rating in the past 2 years. And I do anticipate, God willing, to hopefully continue this. And with that, I will open it up for any public comment.
All right. Thank you, Ms. Cooley. Have we had any comments from the public at this time, staff, Liza? Right.
No, not at this time.
All right, hearing none. Thank you, Ms. Cooley, for that presentation. Board members?
Well, that I would, Mr. Chair,
Ms. Trout?
all that I would like is to congratulate Finance Department for their great job that they already did in this financial results. From the first 5 indicators, we didn't have any no's, which could be a signal of physical distress. So thank you, Ms. Cooley, because it's a great job what you did, Ms. Pekarsky, your department. I really applaud because we are having A plus, A commanded. So thank you very much.
Thank you.
Mr. Chair.
All right, thank you, Ms. Trout.
Thank you.
Anybody else? Okay.
And I move to approve the financial integrity rating system.
Do I hear a second?
Second.
All right.
Okay. Ms. Brigham,
Yes.
Mr. Coronado,
Yes.
Mr. Payan,
Congratulations, staff. Yes,
Mr. Rodriguez.
thank you.
Same here. Great job, staff. We really appreciate your hard work, and thank you again for getting us a superior rating.
Thank you.
Yes.
Yeah. Okay.
Ms. Searles
Way to go. Yes.
and Ms. Trout.
Yes.
All right. Motion passes. Again, congratulations to our staff, our administration, everybody involved. Great news. I imagine that part of the issue with respect to some of the points that we didn't get may have been related to the short-term debt. Actually, I don't know that it's that short-term debt with respect to the maintenance tax notes we did, but I don't know if that had anything to do with it, but you're going into that like that for our kids during this time is certainly well worth it. And we got 8 out of 10 points anyways. Okay, let's go to the next agenda item.
Item 4, Board of Trustee Business. 4A, COVID-19. Session and possible action to approve request for waiver from Texas Education Agency.
Okay, you're still going in and out. Stephanie.
You want me to read it again?
Yes,
Sure.
please.
Yes.
Discussion and possible action to approve request for a waiver from Texas Education Agency for additional transition waiver.
All right, Dr. Galaviz.
Yeah, Andrew and White, can you get that document up, and Miss Rocha and Dr. Reyes and Coach
There they
Brooks
are.
and, the other one that I sent, yes. Can you go down, please? Go down. The other way, I'm sorry, go up. Sorry. You bring it. So board, again, this has been a like the COVID, the pandemic, it's been a moment in history. Let me
All
just
right.
say that. It's been a moment in history. So originally, I know Ms. Roach is on, the TEA was giving waivers in 2-week increments.
Right.
So the superintendent, especially when our, originally the thought was from the city was that the pandemic increase was due to Labor Day. But that turned out not to be true. And as you could tell, within a week, we had a 300% hospitalization rate. So we kind of said, Mayday, Mayday, to the governor and TEA and all our delegation. Hey, we need to not do this 2-week increments because it's dangerous. So we met with Commissioner Morath last Wednesday, and according to the commissioner, he offered more testing. He also said there was research out there saying that when elementary schools are open in a community, the rates go down. Except that doesn't work for secondary. So, but our request is we'd like to have our waiver done in 9 weeks, and that gives us better planning. It gives parents more preparation to if they need to find daycare, if they don't need to find daycare, and give our kids more opportunities, and not just do it in every 2 weeks, given that this pandemic goes up and down. So we met with him on Friday, and then this plan that I sent it to you on Friday, you all received a copy of it. This was the tail end of it. Now, can you go up, please? And can you make it? So we're gonna meet with the commissioner tomorrow morning to go over a Regional 19 basically waiver. The caveat for us is that we're already open. So we're already doing priority populations, taking our students of families that lack effective childcare, parents of essential workers, and we are putting them in learning pods right now. We're also giving teachers the choice to work from home. Again, that's the reason why we went 1-to-1 and we have Canopio Connects. So this is on the table for tomorrow morning with the TEA commissioner along with our delegation, meaning Representative Moody, Representative Gonzalez, Senator Rodriguez was on the call on Friday, Representative Blanco. So, Ms. Martin, do you want to add anything?
Yes, I wanted to add a few things, members of the board and President Coronado and Dr. Galaviz. First and foremost, when we initially did the first waiver, we wanted it to be based on metrics and an indicator that we felt comfortable that we could have students in the classrooms. What we found is when we opened, we were at 7.5 positivity rate. Today, the positivity rate is 15.1. And the hospitalization rate is 41%. So what you're seeing in front of you right now is hospitalization rate. So at 20% and above, which is right now we're at 41%, it allows us the opportunity to keep as many students and teachers and staff at home that need to be home in order for the safety of them. One of the things that we had an issue with when we attempted to do the other waiver, the first waiver, was that we got back from the TEA saying, well, when's the date you're going to reopen? When's the date you're going to reopen? And we kept saying, well, it's based on the disease. As the disease becomes more rises in the county, then we need to decrease our numbers. And as the disease decreases, then we feel like we can bring our kids back in, because what we saw was a jump from 7.5% positivity rate to now 15.19% positivity rate as today. All kids, I want to let everybody know, everybody is learning who needs to learn remotely. Everybody has that opportunity. Teachers have the opportunity for the most part to be teaching remotely. If there are teachers that want to come in and teach from their classrooms, they're being allowed to. And we may need to use teachers to come in to monitor those learning pods. So for example, we have 410 kids today that either due to daycare, extenuating circumstances, or parents are essential employees, they needed to be in our schools, and they are being served by a highly qualified staff member who's there to provide assistance to them. What this process gives us, this plan, is it's based on the disease. There's no end date. Oh, well, you get this waiver for 2 weeks. If it's orange, we follow what's orange. If it's green, we follow what's green. So it's based on the hospitalization rates. And so when we started, the hospitalization rate was 12%. It's now at 41%. So we are significantly in the red zone. And I think that's all. I want to thank Dr. Galavis and all the superintendents in the region getting us all together, because at this point, it looks like all districts have agreed with this plan to submit this to TEA for Wednesday's meeting with the commissioner.
I guess, Ms. Rocha, my question, because we maybe kind of like thinking, does the board still need to approve that waiver that's on the table for today?
This one will supersede that, but we could always, I would appreciate it if we could approve both of them, just so that way we're always clear. The last waiver, the other one that we had, was to stop, was that we would not increase our numbers. When Dr. Okadanza came in, he said, do not increase your numbers to what you currently had. And we had people for the second 9 weeks requesting that their students come in. But with Dr. Okadanza was, you don't want any more kids in. And if anything, you want less kids in your classroom. So that's when we talked to parents and said, with the, you're making the decision with the rise in numbers now with the stay-at-home orders, whether you want your child to come in to a face-to-face or to a learning pod situation where we could have you at our schools. But again, every teacher is being taught by a high-quality teacher through the remote setting, remote instruction, and those students that are in learning pods do have HQ staff that are there providing support, and that's usually with teachers rotating in a few at a time to come in to provide that support. So at this point, I would like both of them to be approved, just so that way we're clear until this one is approved.
I would acquiesce to Steve Blanco, because this waiver right here hasn't been totally approved by all superintendents.
Okay.
The initial 2-week one, but again, I would ask our attorney whether you can do that, whether we can do that or not, because I don't know if this may change tomorrow. Because one of the things, what I don't see in this waiver is funding, because the commissioner hasn't talked about funding. What does it mean when we're in the red zone? What does it mean when we're in the orange zone? What does that mean when it comes to money? Because right now we're at about 95% attendance. We're gathering reports of the other monies that come in, Title I and all that. And so we'll have I don't know when we should have a report by the end of this week to give to the board about where we are. But we still haven't talked money when it comes to the commissioner and our federal government too. Go ahead, Ms. Brigham. I know you have a question.
Mr. Chair, I have a question.
Ms. Burkham.
Yes, Dr. Galavis, thank you so much, sir. So what you're saying is we're only looking at the waiver, the traditional waiver for approval from the board at right now, which is continuation of the 2-week. Okay.
Yes, ma'am.
I understand. Okay. Number 2, sir, is the Region 19. Thank you for that. But so what you're going to be presenting to the commissioner, I believe, is a concerted effort from everybody at Region 19's, along with the health department, saying this is the guidelines we would like to follow, and put the caveat of that 9-week waiver. Is that what you're
Yes.
saying?
Yes, because what we talked about last Friday was having this go until February.
Yes.
And then that way we have, let's look at the pandemic in January. And that way it gives us all that planning time. And because we don't know about Thanksgiving, Christmas, all these holidays are coming up. That we haven't gone through flu season yet.
So this hasn't been, so this is the meeting that you're having, I believe you said tomorrow, Dr.
Yes, ma'am.
Galavis, with the commissioner. So I don't know, maybe you feel better, more optimistic with the commissioner than I. Has any other region, any of the other regions throughout Texas submitted a consolidated, first of all, I love the idea of a consolidated plan. Thank you for doing that. And Ms. Rocha, thank you. But what I'm concerned about is that it's going to fall on deaf ears with the commissioner and the governor, because you're right. Dr. Galavis is absolutely right. If we don't hear about funding, it's all moot. We can't afford anything. So is any other region also presenting something like this? I know we're not the only ones. I know we hold the prize in Texas, but is any other region in Texas?
As far as
doing
I
this?
know right now, no. I think we're the
Okay.
only region that came together. I know down in the McAllen area, they were dealing with COVID, but there are, like Travis County, we're seeing a report that they're like at a 4% positivity rate. They're lower, and Harris County is higher. But given that
Right.
our region is very unique, that it's very together, we just thought let's all come together rather than, because we were all doing 12 different waivers to the state of Texas, and 2
Right.
weeks here, 3 weeks there, and then
It's been absolutely it's crazy for us to do a
Chaotic.
2-week waiver. Absolutely crazy. Miss Rocha, you said on the I don't know who can answer this, either you or Dr. Galavis. You said that you're giving teachers a choice from working from home. Is that different than it was only 2 weeks ago?
Yes, ma'am.
Okay.
At that point, we were opening with a 7.5 positivity rate.
Okay.
So we had about 1,400 kids coming into school. And so we needed our teachers on site to teach those kids face-to-face or in-person learning and remote learning. And so now with the numbers being very small, because parents are keeping their kids at home, and it gives us the opportunity to have kids in learning pods where they can be watching their HQ teacher remotely. However, in some cases, we need teachers to come in and cover those, because we cannot put those pods in like one big room. They can be only in rooms of like 8 to 10 students. So we need somebody to be in there to support those kids. So if a school has 40 students coming in, they can put maybe 5 classrooms, but they'd have to be monitored. And the same thing but we have some schools with higher numbers of students, like Reyes and JDE have close to 100 kids coming in for learning pods. So it may require more teachers to do that, but we're trying to make it very fair where everybody would have a time. Maybe they would work in a pod for 3 days, and then they wouldn't come back until another 3 weeks while they're doing their remote learning.
Thank you for that explanation. And for either one of you, one of my last questions is, what are the criteria for the curriculum, the instructional paraprofessionals, and the hourly, in either this waiver, the 2-week waiver, or the 9-week waiver? Have you addressed that?
For essential employees, that is, we're encouraging when we're in the red zone for principals to stagger those employees that they can. However, we also know that we need our paraprofessionals and our some of our office staff in, because we want to be able to provide those teachers that are there on site with a 30-minute lunch. And so if you have a school that has 100 kids coming in for learning pods, then we have to find ways to manage those teachers to have a lunch. And so we're using counselors, we're using librarians to help us with that, so that we can put more of the burden. That way teachers are then free to concentrate on their remote instruction and doing that effectively. So at this point, it's all hands on deck to make sure that we're staggering as many as possible. If what Dr. Galavi says, if you can work at home, and then you stay at home. But the principals are organizing that and kind of rotating their people.
Mr. Chair,
Mr. Bayan.
can you give us a breakdown of the grades at the high school, the middle schools, or the elementary schools, as to how many each one of those have? How many pods per elementary, middle school, high school?
Yeah. Attendance.
Right. I can tell you that, how many are at each school, but I don't have it according to grade level. But I can send that and put it in the Thursday packet. But like I said, the 3 highest schools that we have are JDE, RES, and GES, that have the highest amount of numbers attending school.
Let's see, and for example, I was at CMS had 22 kids yesterday.
Yes, and AMS had 45.
AMS had 45. The high school had 16. So, but we'll break it down by grades for the board. That way you guys can get a picture. But again, it's kind of to echo Ms. Brigham's point. It's all about funding, because if
But you are taking into consideration these, I guess, professional teachers that have health issues, to make sure that their issues are addressed as far as their health and vulnerability?
yes, sir, it's case by case.
Okay.
We look at them case by case, depending. Yeah, but we look at. I mean,
Good. Thank you.
Dr. Reyes would account. It's here and it's real.
Mr. Chair, I have a question.
All right. Is that all, Mr. Bayan?
Yes, sir.
All right, Ms. Searles.
Yes, Dr. Galavis, with this longer, a 9-week period, even with the 2-week period, whatever it is, did the teachers have the tools at home that they need to teach effectively?
Ms. Rocha, you want to take that? I want to say yes.
I mean, do you understand my question? Like in a classroom, you have, I don't know, a whiteboard, an overhead projector, learning tools that the teacher uses in her classroom. How does that work at home?
So a teacher has their laptop, their device, the new Apple one. They also have their computer that they had from last year. We did not pick any of those up. Some schools have purchased.
They didn't go to Fabens?
No, ma'am.
Okay.
They have their old laptops. And
Okay.
in addition, we have purchased swivel cameras. Now those have not all come in, but when they do, that would be able for a teacher. It's more for when they're in the classroom. At home, we had an extensive PD during the GRIT conference showing teachers applications that they could use in their classrooms that could help them do polls, that could help them highlight information or show them kids to be interactive. But I also want to say that I don't want to give the impression that a student is sitting in front of a camera all day. The part is that they're doing asynchronous and whole learning. So there may be times where like this, And then I might say, I want everybody to go and work on their asynchronous assignment. And I'm just going to keep maybe Stephanie and Mr. Payan to work in a small group with that person, those students, to help them. We also have bought the Seesaw application and Google Classrooms. So teachers can upload their lessons there where students can access them as well. So it's mainly in the middle schools and high schools where you have more of the synchronous, where students get the information for 30 minutes and then log off, do their asynchronous work, and then their next class begins and they may log in for another 20 minutes for that teacher. So, but yes, we're trying to provide them as many tools, but also it's, we've already had the big investment with the 5 million and we put in the PD. And so we feel that our teachers are doing a very good job. I mean, hats off to our teachers.
And
Yes,
there are
I'm sure
teachers.
they are. I just want to make sure they have the tools to do that good job at home.
And just for the record, that phone is Miss Searles. We can't get her picture in.
Okay.
I'm here.
Yeah,
Yeah,
but Miss Searles,
Thank
there are teachers that have volunteered to come into their classroom because they.
that was my next question, Dr. Galavis. Do we have any of that where the teacher is in the classroom and not any students, like they have for the baseball game, for the World Series, no
Yes,
fans?
We have teachers that want to teach from their classroom.
Okay, and we can accommodate that happening?
Yes, ma'am.
Very good. Thank you. So it sounds like we're trying to cover the bases, yes?
Yes, ma'am.
Thank you. And thank you, Ms. Rocha. I appreciate it.
Absolutely.
Just please make sure they have the tools to do the best job, because I know they all want to.
Yes, they do. Thank you.
Thank you very much. Thank
All
you,
right,
Mr. Coronado.
Thank you, Mr. Olson. Anybody else?
Mr. Chair,
Mr. Payan.
I just want to commend Dr. Rocha and all staff, Dr. Galavis. I know my granddaughter is going through this process remotely, and she loves it. My daughter loves it, and she's, as far as I'm concerned, she's doing great. Thank you.
All right. Thank you, Mr. Payan.
Mr. Chair,
Mr. Rodriguez.
I had some questions. Dr. Galavis, can you please go over the attendance numbers you were giving at the high school and middle school? Is that per classroom or is that district-wide?
I'll answer that. That's district-wide. When we're saying that, those are actually the ones that need to sit in a learning pod. And the reason the number is low at the high school is because those students can be alone. They can do the learning asynchronously or logging in. You have bigger numbers at elementary schools because if the person lacks childcare or there's an extenuating circumstance, those kids need a place to be, and so they're at the elementary schools.
So can you go over those numbers again? I know there was 2250.
AMS we had I have the days, which is a little lower than it was yesterday, but I had 35 at AMS, 13 at CMS, 45 at CES, 19 at BCE, 94 at JDE, 73 at GES, 11 at DDE, 103 at RES, and I believe Northwest had 3.
So those are the total number of students within
Campus?
Yes, that are coming onto a learning pod. Everybody else is being taught asynchronously or at home, and they do count for attendance. That's why our attendance rate is about 95% right now as a district. Of course, we'd like it higher, but even with because they, as kids interact with their teachers, they are counted for attendance, just like I would count you all as being in attendance at this meeting, even though you're at your home or your office.
Dr. Galavis had mentioned something about 75% attendance. Is that one of the campuses or would that be the 95%?
No, the 95% attendance as a whole.
But you mentioned 75%. Would that be in regards to
Students.
what we're being able to report to TEA?
70.
Students in certain campus, right, Dr. Galavis?
Yes, there's certain students, not
Grades.
percent.
Mm-hmm.
And so in regards to the current situation is we requested a previous waiver before, and now we're requesting another waiver because of the way TA has set up the 2-week system. And we're hoping for a different system to be approved with the regional school districts. Is that correct?
Yes.
So in regards to the regional, I guess, pamphlet or the flyer that was put up in regards to how that would be followed, is every district in the region 100% on that? Or are we seeing others? Because my understanding, and the reason being is El Paso ISD was looking at the World Health Organization numbers instead of the local county numbers.
That was for the 4-week waiver that we had previously, but that now is no longer in effect for any person. They set it at 5. We set it ours at 7.5. This one, yes, EPISD, it's going to be based only on hospitalization rates. And at this point, we have EPISD, Clint, Socorro, Canutillo, I believe Anthony, San Eli, Fabens, and I don't know about Tornillo. But they've all had input, and we've all had meetings on this. And the idea was the going by the hospitalization rate. Now there have been some questions on what do we consider priority school to students. You know, we believe if kids need that extra support, we're gonna service them as well as much as we can. But some other schools may have a different, like they really want to keep it very tight.
Also, there are parents that have to work. There are parents that can't, so that are work at Walmart or work. So our economy has not, our stores have not shut down. So we have to honor that, those families. And I really think our kids are safer with us in our learning pods than at home by themselves.
Or they need to use the technology of the campus as well.
Technology or somebody there to help them with the homework.
What I was trying to clarify, and since this is a live meeting, I have a good understanding of it, but in regards to, we're looking at it regionally now, but previously is how come Canutillo got a waiver, but yet El Paso ISD was still closed. Can somebody touch on that, whether it's whether it's legal, or I'm just trying to educate the community in regards to that, because there's been misinformation.
Absolutely. So we had the first 4 weeks that the commissioner gave to every school district in Texas to transition. And then everybody, you could put in another 4-week waiver, but it had to be based on medical evidence. And the county health department, Dr. Ocaranza, said that the positivity rate at 7.5, if we reach the positivity rate of 7.5, it would be safe to bring in schools. So that's what Canutillo used as its threshold, saying that once the county reached below 7.5, we would open schools. EPISD used the World Health Organization and used 5.0. That they use that as their medical. We stuck with our El Paso County, but EPISD decided to use the World Health Organization. There have been many people who contacted Dr. Ocaranza about that. Why 7.5 and not 5.0? And Dr. Ocaranza's response was, well, I'm only looking at what here is in the county. I'm not looking at the entire world. And so in the county at 7.5, it is safe to open up schools. And we were doing well when we opened at 7.5. It was only when the previous 2 weeks before intersession that the infection rate was rising, that it was causing us to have to put teachers in quarantine, not because they had COVID-19, but they may have been exposed to someone. And so that's when we started sending grade levels homes or classrooms home. And that's really hard on the workforce because these individuals may not have COVID, but yet they have to quarantine for 14 days. And that was very hard on the workforce.
So going back to either the waiver gets approved by TA, if the waiver does not get approved, or then my question is, TA only allows you to do two things, which is one, provide face-to-face, and provide online remote learning to parents and students. They're not focusing on teachers, they're just looking at the numbers in regards to students. Your only option is to provide face-to-face or online learning, and that's what Texas Education Agency is providing us. Is that correct? And can you?
No, sir. No, sir. We have to provide everybody a remote learning option. Everybody is given that.
That's what I said. You have two options. One option is remote learning, and the other option is face-to-face.
Well, I don't want to say that you can say we're going to do 100% or remote. We can't do that. That's not an option to be 100% either way. I mean,
Okay.
You know what I mean?
We're only providing, they're not giving the district an option to provide remote learning. They're giving us a mandate to provide online remote learning to parents and students, or face-to-face.
Yes, and face-to-face for any student that wants it. So after our waiver, November 9th, if this new waiver by Region 19 is not approved, then we'd have to open our doors to anyone who wanted to have face-to-face learning, regardless of what the judge says, regardless of what the positivity rate is, regardless if we're in the red zone. After November 9th, unless this one is passed or accepted by TEA, then we'd have to open in order to get funded.
Okay.
Okay.
The other questions, concerns that the community has brought up is getting a hold of somebody if some technological glitches happen with the computer or something. I'm hoping we're coming up with a better system to be more responsive in case there is technical difficulties as we move forward with the one-to-one devices. And the other is also the filtration systems. I've been at central office and currently here, but looking at hopefully better filtration commercial type systems. So those are two comments. And then the question that we keep on getting, and I've seen on whether it's social media or emails, we keep on getting asked in regards to the teacher's choice, right? We're trying to balance this, and I know we're in a difficult time in regards to TA has given us the option to provide options to our students and our parents that have students in our classes. But in regards to teachers, we've tried to take a balance in regards to looking at underlying conditions, providing them choices as well. But for some reason, there's information going out that some FMLA requests are not being given. Is that because we're balancing it out, or is that because certain issues? If a teacher has underlying conditions, how do we look at that approach? And that's my concern.
I don't know if Martha could ask, but is this deal, can we talk about the waiver? Because, I mean, because that is a case-by-case situation with FMLA. I mean, doctors were giving blanket, you know, they can't come back to work until the pandemic's over. Well, that doesn't, you know, define an underlying condition. So it's given really case by case. So it's really hard to really clump dump a name, if you will, into categories on who gets a FMLA and who doesn't.
What is your recommendation, Dr. Galaviz?
To do it case by case.
And
I mean,
And that is what we're doing. We're looking at each request on a case-by-case basis. It depends on what the condition is, if it's explained, if it qualifies for an FMLA, and it's got to have a qualifying illness. And so those are spelled out in the Department of Labor. And I know Steve is also assisting with some of the ones that are questionable. He's provided me some information from the Department of Labor. So those are things, I mean, it's got to be spelled out, and it's got to be, you know, an illness that qualifies for FMLA.
Mr. Chair,
And
I'm sorry.
if I just the last question I have is, are we providing that information and that process to our employees, as well as a process if, I guess if an employee does not agree, then what's the process after that? And is that where Steve is helping out? Just so that way we could, and that would be my last question.
All right.
Yes, the information is spelled out in the paperwork that we provide the employee. However, if it is a questionable one, I know I have reached out to Steve, and with his guidance from a legal perspective, you know, we do relay that information to the employee. And like I said, we're trying to be very, we're taking each request very seriously, and we give it some careful consideration. And of course, we have various other leaves right now. We have the COVID leave. We have, you know, different types of leave. And so we always try and look and see if they don't qualify for this kind of leave, then what other kind of leave can we offer them based on the information that they provided us.
All right. Anybody else? Is that it, Mr. Rodriguez?
For now, Mr. Chair, thank you.
Yes.
All right.
Mr.
Anything
Chair.
else?
Mr. Chair, it's
Hold on,
Annette.
Ms. Brigham.
Okay.
Hold on, Ms. Brigham. I think, I mean, let's see if everybody else.
Absolutely, sir. Absolutely.
Okay.
I do have a question, Mr. Chair.
Ms. Trout.
Ms. Rocha or Dr. Galaviz, how long are students they spend the time while they are receiving instruction at home at computer time? Is it the same time as they go physically?
It varies for, in order to be funded or counted for attendance, there needs at least 240 minutes in secondary, and elementary, it needs to be 180. But remember, it all depends. The younger kids, like pre-K and kinder, will do a lot of learning asynchronously. They may be with a lesson, and then they go off and do work on their own, because it's very hard for a smaller child. Older kids, it's kind of like college. You're going to go and see the class like you would the professor online. So you may have more synchronous learning, where you're in front of the computer listening to your teacher, your professor. But the idea is, we don't hope any kid has to just listen for 8 hours to a teacher talking, that the teachers are using, are saying, okay, well, maybe 15 minutes, and then they break up into groups, or they go into discussions, and they use various instructional strategies to keep the kids engaged without having to just sit and listen.
Yes, because I think it's 8 hours of instruction plus on top of it homework. I think it's so many hours for them to be in the computer. I do understand that we need the funding, and the kids, they need to abide with those minutes. Plus on top of it, the homework. I mean, I think it's too much for them in computer, but maybe we can talk that in some other time.
We can address it, yes, and with our principal meetings, and discuss with teachers about it as well.
Thank you so much. I appreciate it.
Thank you, Ms. Trout.
Yes, sir.
All right. I have a few questions. Marnie, you gave us the numbers of those students that are attending at our different campuses, but some of those are actually in front of a teacher. Are there any of them that are doing remote learning from our schools and just with the help of aides?
Yes, so we have that also as well. So in some cases, teachers are there in schools with them, but we also have HQ teachers that are in the room to provide some type of instructional support. So because the students that are coming into the learning pods are learning with their remote teacher. So they'll have their AirPods on, they're being supervised. And this is mainly for essential workers or parents that need to work and they don't have anybody to be with their child. And so those are the kids that we see at learning pods, but they always have the ability to ask an HQ staff member, I need help. Can somebody help me, assist me? And that we don't want these kids to be unsupervised.
Right. And Marnie, the numbers you were giving us, that includes everybody, the ones that are in the pods and that are in face-to-face with teachers at school. Is that right?
Yes, sir. Yes, sir.
All right. Do you have an estimate or can you give us an approximation of how many students are actually doing face-to-face that are at school, not the pods?
Well, I want to clarify that even when kids were coming to school,
Yes.
and having the teacher before the intersession, teachers were still teaching afar, having those students, like a teacher would teach from their desk and their students would still be at their desk.
Right.
So it wasn't that traditional, let me get up and teach, as you'll see in the like pre-K through 2 classroom. But in the older, when I was walking through, is more of the teacher still at her desk with her laptop and the other teachers, the other students at their desk with the kids at home. So it was basically, in my opinion, the same thing. It wasn't that traditional, let me get up and draw.
All right. And Marnie and Dr. Galaviz, one of the concerns I have, because one of the comments we got from one of the community members about our parents teaching that we're not providing a safe environment.
A safe environment in what way? And through in the virtual world or in or in
the teachers that are here that are at the school?
Face to face?
Yes.
No, they everybody's with an adult in their classrooms. They or where they are. We've limited those numbers to usually less than 10, so they would not be enlarged to be exposed to anybody. They're still having their washing and wearing their mask. All those things have to happen. So I'm not sure where they would think. And of course, a parent always has the opportunity to let their child go remotely. If they feel anything is unsafe, but nothing's been reported to the principals at this time. And I called most of the principals today. So I don't know where they would think that anything is unsafe.
And we do have our protocols in play with and Dr. Reyes, because she works probably 32 hours of the day with COVID cases. So we're about to get some rapid testing from the state of Texas that's going to help. But and we have sanitized those dispensers everywhere in the district. We have masks.
Temperature checks, masks. The kids are divided, separated. They're eating in their classrooms, the ones that are coming in. So it's we're limiting the numbers that they are in a classroom, and there's always should be an adult. Now, like I said, 30 minutes of the day, we need to give we want to give teachers a lunchtime, a break. And so we may have an office staff or a counselor go in to watch these students while they're eating lunch, just like we would in the cafeteria. We have teachers and aides doing lunch duties, custodians, everybody helping to watch kids. We may be doing that because, the teacher, they need a break somehow in their day if they're manning this. So if that's what the parent is saying, then maybe for 30 minutes when the kid is eating lunch, there may be someone from the office staff assisting, giving that teacher a bathroom break.
It was, yeah.
Okay.
So,
I just want to address those concerns because one of the community members spoke out about that in the open forum. And so that's why I was wanting the staff to address that.
I would definitely say that anybody who has a concern needs to reach out to their campus principal. And then if not, to Dr. Reyes and myself will be on it. But at this point, like I said, I've not received any of that from at my office. And I don't think Dr. Reyes has either at this point.
No,
If I
Announcing the
may,
protocol. Dr. Reyes?
yes, sir. If I may, I would like to kind of dispel a little bit of the image of the campuses and being safe. As of yesterday, we have had 45 positive cases affiliated with our students and our staff that have participated either face-to-face or athletics, okay? So those cases totaling from September 14 to now have been 45. Of those 45 cases, none of them have been a spread on the campus, on any campus or any facility. All of them have been exposed to someone or picked up COVID on the outside, not in our schools. So we currently have 31 of those 45 cases that are recovered, and we currently have 14 that are positive. Now that's as of yesterday evening at 9:00 p.m. But I do want to make sure that I reiterate, as we do our contact tracing and we are working closely with the health department, all of these have been from either being out shopping or going out to lunch with someone or dinner with someone, close contact outside of the school. It hasn't been in the schools. So I just want to paint that picture, because we are closely monitoring this as we have to record and report on a daily basis to the health department and on a weekly basis to the state.
All right, thank you. And my next question is, where are we on the fast testing? Because we spoke about this on the fast testing, Dr. Reyes and Dr. Galaviz, several meetings ago, and y'all were going to get on that. Where are we on that? Because I'd really like to see that soon.
So we're participating, we're looking at participating through TEA's promotion, and that is actually due tomorrow. As we speak, Nurse Berumen is performing the training portion of the testing coordinator, so that we are able to say that we have someone who has gone through the program, understands it, the management of it, and then once that happens, we can finalize the request that Dr. Galaviz has already submitted to the state, and then those tests will be coming our way. What I do want to reiterate or explain is these tests are part of a screening process. It's not a diagnostic test. And so we're very fortunate to have seen and spoken to Fabins and to several other nurse coordinators that have been able to provide some more information as to how they've implemented it, how they acquired it. And so we are working on that, and hopefully that will be coming forth within the next few weeks. We do need to identify who's going to be trained at each campus, who will go and participate in the training, and who will help to implement this screening using the COVID rapid test kit.
Sure.
Okay.
All right. Dr. Galaviz, you want to speak on that?
No, I just, again, I know Dr. Reyes has set up our clinic on Thursdays. I know a couple employees right now, they can get tested on Thursdays. I think there's another day, right, Dr. Reyes? When
We have worked with Project Vida, and so they are actually testing on Thursdays all day. They have been pretty busy in our community as they have had nonstop requests to be tested. So that's every Thursday. We are looking into seeing if we can be provided the proper PPE and work with the Office of Emergency Management to see if we can do an additional day with our nurses for a few hours on Tuesdays, so that we have a balance of those people that meet the criteria of an exposure 5 to 7 days after to be able to test.
Right.
So we are looking at that as well.
Okay. All right. I want to make sure that, we are taking all the safety precautions necessary.
Should we do a 5-second commercial about the flu clinic,
Sure.
Dr. Reyes?
Thank you. So along with COVID testing, and because COVID is here,
that doesn't mean that none of the other viruses are not existing. So we still have strep throat, stomach viruses, the flu, both A and B. So we need to make sure that we are doing our best to vaccinate. And thanks to you all last month in helping us to get into that interlocal agreement with the city of El Paso. We have our flu clinic tomorrow from 9 to 4, 9 to 3 for the community, 3 to 4 is specifically for employees. It will be held at Alderete Middle School, kind of like the COVID testing that we did during the summer. So it's going to be going entrance through Talbot and exit through 6th Street. So that's going to be held every month and we'll be pushing it out. So we're having that tomorrow. There's about 19 employees from the city of El Paso, the health department, and then 4 to 6 of our employees that will be there to support the flu vaccination clinic. It's free. We need to get everybody vaccinated as much as possible to ensure that everyone is safe during COVID and of course our entire flu season that we have on an annual basis.
Well, great. I think I might be there to see the process and maybe.
Absolutely. Or get the shot.
Oh, which are the requirements, Dr. Reyes, that of course people that need to attend would not know feeling sick, or what is this? Tell us, please.
So as far as the flu clinic is concerned, like myself, I just came off of COVID and still have not fully recovered, have not recovered to be well, even though I'm no longer infectious. But I cannot do the flu shot yet. I have to be completely well. So for anyone that has either been exposed to a COVID, is quarantining right now, or is still not completely well coming off of COVID, you should not take the flu shot at this point, okay?
Thank you.
There is paperwork. Yes, there is paperwork on the website that you can download and fill out, so that way it speeds up the process and have that prepared. If not, they do have the paperwork there. They ask that you wear a short sleeve shirt because it is a drive-through, and then you will be wearing your mask. So the process is set up, and the city of El Paso has been doing this at other sites. So we're just going to follow their lead tomorrow.
Good.
Thank you.
I hear our nurses give the best shots in the region.
Mr. Chair.
Ms. Brigham, you have something else.
Yeah, Dr. Galaviz, going back just real quickly to your waiver, either waiver, the one that we're going to approve, that we're going to vote on for the 2-week, or the one that for the longer period of time, have you addressed the issue of the testing and accountability to put a waiver on for that also, sir?
No, not yet, ma'am. That's the next waiver.
I didn't know if it was going to be in there. So thank you so much, but you are looking at that.
Tomorrow morning, I'll tell the commissioner that our board is wishing, because I guess I'm assuming you all would like to waive the testing.
Absolutely.
I would think so. I mean,
I don't.
Absolutely. And I just was wondering if when you're talking to the commissioner, if you could bring that up. So that's a question I had, Mr. Chair.
Thank you, Ms. Brigham. You know what, the other option, Dr. Galaviz, is that, that maybe give the option of the school districts to say, okay, we're going to give the test, but it's not going to count against you.
Exactly.
Because we may want to still have a test and to see where
but not for accounting. Yes, exactly.
Yeah, see where our kids are.
It's not the issue about not taking the test. It's about not it hurting us because of the COVID slide.
Yeah. Well, I think when I had a conversation, I think it was with, why are we doing all this, right? Why are we playing school? Because I would like to see where are our kids when it comes to how much growth. Because there was a large investment with the laptops and the kind of Deal Connects and, and learning pods. And so I think there should be some sort of measurement, what it is. But I agree that accountability, we shouldn't be held accountable for ABC. Let's worry about the learning of the child.
Right. I get it. And that's why my comment was that we don't necessarily want to not have them do the test, but let's not have it be something that is held against the district because of what's happening. So anyways, I get you all will take that up. If you need help from the board, let us know.
Yes.
We can.
Is this item is still going to need an action?
Yes, I would like the.
Okay.
Yes,
I would like to move to approve the request for a waiver.
Second.
Okay.
All right, we have a motion and a second. Any further discussion from the board?
I do. I had, in regards to, couldn't we just approve the administrative waiver that the regional waiver included on that, just in case? I mean, it's just.
Well, I don't know, Steve, can they do both? Can both be included? Because this.
Yes. Yeah.
You say yes?
That's a good suggestion, because I don't know, and I don't think the districts know yet, the extent of the time periods that TEA will be granting for waivers. So to the extent the board's in agreement with Mr. Rodriguez that you allow Dr. Galaviz to go forward and secure the longest possible waiver extension, you can approve them both.
We could.
Okay.
We could do that, Steve, but Dr. Galaviz, you had a concern with respect to the funding issue. If it's tied to any of those conditions. So how are we going to handle that, Steve?
Exactly.
Well, the waiver would have to be a waiver that does not impact funding. That's the issue. TA is either going to say yes or no. They're going to say, sure, you can have an additional time period and it will not affect your funding. Or TA is going to say, nope, no additional time period. And if you don't open, it's going to affect your funding. Or sure, we'll give you an additional time period, but it's going to affect your funding. That wouldn't be what you're approving. It would have to be a waiver with no effect on funding.
All right, so then we just need to make it clear if we're going to do that then.
So then the motion is for both, Mr. Chair.
You would have to amend your motion, and Ms. Brigham would have to amend her second.
Okay, I would like to amend my motion for both waivers.
And that would be to include that it would not affect our funding.
Would not affect our funding. And I would like to include it and very clear that it will not affect our funding.
All right.
I second then.
And
all right.
I had just, Mr. Chair, I had two questions. One in regards to the COVID-19 statistics that Dr. Reyes had mentioned in regards to the face-to-face versus online. You're saying, is it face-to-face and online, or just face-to-face on the 45, 14, and 31?
That would be face-to-face. That's for people that are in our schools, either doing an extracurricular activity or are there for instruction. Right. Because that's what we're trying to monitor as far as community spread within the schools. And so those numbers are specifically face-to-face and athletics.
And I guess in regards to the information, there's been talk about putting these numbers in regards to campus. Have we looked at that?
So I worked with actually Liza this morning, and she worked on an Excel spreadsheet that we've inputted. We're looking at doing a more live dashboard for our website. We're still determining what information we're going to be putting in there. We need to talk to cabinet about that. But there is more information that we have accessible now with the numbers unfortunately increasing. So Liza and I were discussing that actually this morning. And the dashboard will look a little different as we work with Tableau. Liza, I don't know if you want to add anything to that.
Yeah, that's correct. We're looking to work with Tableau and changing our dashboard a little and offering a little more data, richer data, and bringing in county data as well. And also it'll connect to the numbers that Marnie showed you earlier, the red, orange, yellow, and green will be representing what color we're on at the moment. So it'll be more of a live picture than what it is right now.
Okay.
I can tell you, for example, I gave you the numbers of 45 as of yesterday at 9 p.m. We already have 5 more today.
Yeah,
and I'm not done. So,
yeah.
And that's just today.
No, and I commend administration, Dr. Reyes. I know these are difficult times, but I think the most important thing is to be transparent with our community, and we have done that. And I think just how do we increase that transparency and that, I guess, knowledge. So I just appreciate the district taking the lead on that. I know at the beginning the media was all over it, but it was, you know, we weren't hiding anything. We were just being transparent with the community, because I think it's important for us, not only for us to be proactive, but at the same time, be able to tell our community what's really going on. So I thank the administration for that, and our teachers and staff currently in this situation. I know they've you know, rolled up their sleeves. There's still a lot of issues that need to be addressed, but we're in a time where we're trying to balance everything out and do what's right for our students and our staff, and trying to see how we could move forward with this. And so I appreciate everybody. And the last thing I know in regards to the waiver, I believe we have passed a resolution in regards to TEA asking the federal government to waive that. I know it's been political. I've been in several meetings with Commissioner, I was going to say Williams, Commissioner Morath, and I point blank asked him that question in regards to asking the federal government to waive the testing requirements. And he pretty much bounced around the question, and we're hoping, I think we need to look at assessments internally, and I'm sure we're looking at that. But at the same time, I think TA is gung-ho in regards to that test, and I think maybe the approach might be, it's okay to take the test, but let's make sure that it's not held against the district for in this current time.
Mr. Chair,
Ms. Searles.
even though we do have a motion on the floor, it sounds like everybody still wants to talk about it. So I'd like to ask a question. Dr. Galavis, how are you going to relay this to our staff, our parents? How will we get the word out? Liza, have you come up with a chart? I think El Paso School District this afternoon sent out a chart of what they were doing, who it included, how this would affect everyone. Are we ready to do that? Have we done it? How are we going to get the word out?
Are you referring to the color that Marnie mentioned earlier?
Mm-hmm.
Well,
and on this transition, how are we going to, get the word out on the transition to everyone?
Well, every week we send a message to the community. Ours is a little bit different from the other districts because we've opened our doors. But the color coding is on our website, and Marnie is also working an eye on a document that makes it easier for parents to understand what it means to them and to their children.
But on this waiver request, how are we going to get that out so everybody knows, this is what it is. Here's what you're going to do, and here's what we're going to do. And this, how will you communicate what we've been talking about tonight to the community, I guess? Do you have a plan?
Well, I think it's as we've been in, there's a lot of communication going out. There's messages that go on social media, parents email, we send text messages. Is that what you're?
Yes,
how do we
exactly. That what we're doing right now is something new. The board has got before them a motion to approve one waiver and then another possible thereafter if everything goes well for Dr. Galavis and Region 19 superintendents tomorrow. So do you have a plan in place to relay that and communicate that to everyone?
Regarding the first waiver, we did send information out to the media and to the community already saying it was pending board approval.
Okay.
And we sent out another message Friday regarding the new color codes as well.
Okay. And for this additional one that could happen tomorrow,
yes,
of the 9 weeks, that will be handled as well?
Correct. Yes, Dr. Galavis and I and Marnie and all of cabinet are in constant communication. As soon as he's done or we're on the meeting with him, we'll convene, see what changes, and then we start writing up what we're going to send to the media and to the community. And it's always the same. It's via email, website, social media, and text.
Very
and
good.
depending what the message is, we'll also do a call out.
Very good. Thank you. I appreciate that.
And just sometimes we send a high level message out, and then school principals will handle contacting parents with further details, because every campus sometimes is a little different.
Okay. Thank you.
You're welcome.
Thank you, Ms. Earls. All right. With that, I think we have a motion on the board, an amended motion. First, let's take a vote on the amendment to the motion. All those in favor of the amendment, please. Aye.
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 All right.
Aye.
Okay. The motion to amend the motion, the main motion passes. And now let's take up the amended motion at this time. Stephanie, would you please poll the board?
Ms. Brigham,
Ms. Brigham.
Ms. Brigham,
Ms. Brigham contacted me that she lost connection.
All right.
We're
Go on
continuing to reconnect.
All right, go on to the next board
Okay.
member, and then we'll
Yes.
try to get back with her.
Mr. Coronado,
Yes.
Mr. Payan,
Yes.
Mr. Rodriguez,
Yes.
Ms. Searles,
Yes.
Ms. Trout,
Yes.
All right, is Ms. Brigham back on?
Not yet.
All right, okay, motion passes. We will ask for Rich's position on that when she joins us back in, but let's go to the next agenda item, please.
item B. With TEA corrective action plan.
Okay. All right, and we brought this up because with reference to the ethics training that we had, was it 2 weeks ago, I guess? That Mr. Craybill advises that with respect to the LSG training that the board and the district has agreed to with TEA or the corrective action plan, that it needs to be attended by all board members. I know Ms. Haloma indicated to us that there was one board member who indicated that would not attend. And so Mr. Craybill indicated to us that if we have told TEA that the entire board is going to go through this, that we better honor that commitment, or there would be consequences. Dr. Galavis, have you spoken to the TEA officials?
Yeah, I talked to Leslie King,
Okay.
and she was, and I can send the email to the board, but she was very insistent that the board doesn't have a choice under the cap, whether to go or not to go. I think there are some circumstances with regard to health and COVID that they may look at, but other than that, if there's not a viable excuse not to go, then she did, or Mr. Craybill at the time did mention about possibly a monitor for the school board. So I just want to, whether it's this board or the board, she didn't really care that a Gallup School Board will attend that LSG training. And we have an extension until March, the end of March, to get it done.
All right.
Mr. Chair,
Mr. Rodriguez.
I believe we need to be transparent with the community. The fact is that Ms. Searles has stated to those individuals that she does not want to participate. And I believe the majority of the board has participated already in one section of it. And we know that It was well worth it, and we believe, not only do we believe that it's good for the board to attend it so we could focus on student outcomes and moving our district forward, but it's now required by TA for us to complete it as a board. So I believe we have to be transparent with the community in regards to what happened.
Okay. All right. Well, I think the board needs to discuss about, these are serious consequences that the board and the district faces. And so I think that the board needs to decide to take some action with respect to any individual board member who does not, has indicated they want to participate. And the only options I see is that that the board censure the individual board members who do not have indicated they want to attend, and also remove any of the privileges that come with being a board member in respect to the district issues. There are certain rights that, of course, the board cannot take away from any board member, but with respect to other privileges, as was indicated to us at the ethics training, that those can be removed very easily by the board. The more rights that board members have is as a board, not as individual board members. So at this time, I'll open it up to discussion from the rest of the board.
Mr. Chair, Mr. Chair.
Ms. Brigham.
I'm sorry, I don't know what happened. I apologize to all the board members. I'm still not on, but thank you, Andrew, for letting me, he sent me a link, so I lost my link on the computer, so I apologize. I just got back online, Mr. Chair.
Okay, Ms. Brigham, we are discussing.
The next item, it was the next item, right, sir?
That's correct. We're discussing the compliance issue with PEA regarding the corrective action.
Yes. We have I have it in front of me, sir, the corrective action plan. And I got on, I heard some of the comments I think that Mr. Rodriguez made. I did adhere to, go to the ethics training. I do think that, and I heard Dr. Galavis. Dr. Galavis, did you say March? Did they extend it to March, sir? Mr. Chair, you can answer that. Did TEA extend it to March of 2021? That's my question.
Yes, they did. One of the reasons for that is that one of the board members had indicated that she would not attend. So we tried to get an extension. Dr. Galavis, you want to talk about that?
So we did get the extension, Mr. Chair?
Yes, we did.
Okay, so then I move that we look at fulfilling that requirement before 2021, March 2021. That's my suggestion.
I'll second that motion.
Okay, well, there's a motion, but we need to talk about, the reason we had to move it is one individual, Ms. Searles, indicated that she didn't want to attend.
So, Mr. Chair, let me discuss this. The reason, and I spoke to the commissioner, the assistant commissioner personally about this. Mr. Rodriguez, if you'll look, one of the violations, we have two violations, very specific violations. One of them is the systemic harassment and bullying, and I will not be bullied by Mr. Rodriguez any longer. There's no way that I should be offended, bullied, harassed. My civil rights, as well as my rights as a taxpayer and citizen, be just destroyed by him at each meeting. We've had more than plenty comments made by members of the public about the treatment of Mr. Rodriguez towards me. And that is precisely why I said that I wouldn't come until after we had the election, that possibly our community has had enough of listening to the bullying that goes on and the harassment that goes on, and truly the discrimination that I felt and that I feel. I don't have to feel that way. That is not part of being a board member. And I really resent being treated the way Mr. Rodriguez has treated me. And that is precisely why the assistant commissioner has given us this extension until March, because I asked him that he would do this, because I'm hoping our board will change and we will go through the LSG training. I'm happy to go through it with people who are civil, who I can sit in a room with and not be harassed and bullied by. So I take issue with y'all piling this on me, that it's something I've done. Silence is acceptance, and it's unacceptable in our community, absolutely unacceptable in our community to be bullied. And that is really, that's the only reason that I said I wouldn't attend on the October dates, because I've taken enough of that type of treatment. I don't need to be treated that way.
Well, that's the whole reason, Ms. Searles, that this training is for.
That's correct. And I can't sit in a room and be bullied like I've been bullied in the past. It's wrong. No one should have to be. Our children, it's a bad example too. It's a horrible example to the citizens, to the parents, to the teachers, and particularly the children. We have a code of honor and a code of ethics. And at each and every meeting, it's violated. And I can't take that any longer. That's not part of my obligation as a board member, to be just absolutely treated horribly.
All right,
So that's the end of it. And we've been given the ability to have an extension. There's a motion on the floor. I don't really want to discuss it.
No, Mr.
Because
Chair,
as you can tell by my voice, I'm upset. This
No,
is
Mr.
wrong.
Chair, I'm upset too, because if I might have the floor after her,
Rodriguez, hold on.
I won't interrupt.
You. All right, Ms. Searles, are you done?
Well, I have to say, I'm not going to take his harassment again. It's enough. Every one of our last meetings, he has harassed me and bullied me and discriminated against me at every turn. And I'm not the only woman he does this to. He's done it to Miss Brigham. He's done it to Miss Gonzalez, who is on the board. He's done it to many women in the past. And this is wrong. It has to stop.
Right. Are you done, Ms. Searles?
And so that's what, hopefully, our board makeup will change after the election. There'll be some new attitude that comes into play, and it will be a safe place for me to be at a training for 2 full days of my life. Thank you.
All right. Mr. Rodriguez, you had something.
Mr. Chair, no, I believe that the person that's talking about bully is the one that also bullies other board members. And we've seen it in the past in board meetings, whether it's myself or whether it's Ms. Trout, whether it's other individuals, but she's such a hypocrite in regards to what she says. And the biggest thing is that we have approved this to become part of LSG even before this was a requirement. And here Ms. Searles goes on and tries to file complaints that was not founded on in regards to the barn and other issues of her own conflict of interest. And so this has been an issue that, because I tell the truth, it's bullying. The community needs to be aware of what Ms. Searles does, and then what she says she does in public, and yet she's the one that says that she's not going to attend these meetings when she's the one that filed this complaint. And that's the issue here, is that we even went through this training before it was required by TEA, and who did not attend? I guess Sonia's not around, but who did not attend? It was Miss Brigham and Miss Searles did not attend that original meeting that we all attended, that we all took time out of our weekend, 2 days, to go and learn about how we could focus on student outcomes and moving our district forward.
That's not even what we're talking
Yes,
about. We're talking about the
no,
corrective
I
action
have the
plan.
floor. I have the
Let's be
floor.
clear. Yeah, well,
Chair-
don't lie.
Mr. Chair, I have the floor. This is about the corrective action. We were supposed to do this training. We actually did it as a board and you did not attend and you
That's
never
not
wanted
true.
to attend. Yes, it is
That's
true. It's
absolutely
factual.
untrue, and I
It's
reject
factual.
and rebuke
Mr.
what you're
Blanco?
saying.
Mr. Blanco, can you please?
Board, Mr. Earls. Please do not.
It's factual. It's your attendance
No, I've
wasn't there.
taken all of your abuse. I'm
I
going to
have
take.
the floor.
Stop.
You know what? Let's just
That
move
doesn't
forward
give you the
because
ability to lie and abuse me.
you do the same. It's a
Mr.
mutual respect. I've had a conversation and I haven't bullied you. I'm just telling you that you should be held accountable to what you've done for this school district by putting us
No.
in this position. Yes.
That's not the
Mr.
truth.
Chair,
They're
I
two
call the
different
question.
issues. You went
I
to
call
an
the
LSG
question.
training.
Ms. Earls?
Now we have a corrective action plan
Hold on.
where we're required to go, not choose, required.
Ms. Earls, please do not.
Exactly what I said.
Let Mr. Rodriguez finish.
Exactly what I said. We had all voted on to become part of LSG training, and now we're required because you submitted complaints about a barn, which there was no found on the district making that decision and moving forward. So I
But you
call the question to move forward.
All right.
Second.
All right. We have a motion and a second. Any further discussion from the board? You know, let me say something. I think we really do need to, as a board, completely do our team building. And, you know, we tried that 2 weeks ago with the ethics that we went through, the ethics training, but not all board members attended. You know, it's imperative that we all attend these meetings that are the team building, now this LSG training. You know, sure, we all have different things that sometimes keep us from attending meetings, but these things that, you know, are some of the primary things that we as a board have to do. And we have to make the effort. Nobody forced us to get on the board. Nobody forced us to run. And if we're gonna make this as a team and run the district as a team, then we need to attend these team building. We need to attend this LSG training. That's just the way it is. And if any board member doesn't want to do it, then maybe they shouldn't be.
Resign.
Because that's what it's all about. And this is some of the most important things that we do as a board. And we need, you know, we don't all have to agree on things, but we need to make sure that we respect each other and we're all on the same page as a team. And once the decision is made by the board, then, you know, you can't take things personally and keep at it. We've got to move forward and support the decision of the board and move forward. So I'm just, you know, hoping that our board comes together after the election. Whoever it is that may sit on this board needs to take that in mind. So with that,
Mr. Chair,
yes.
are we going to set a date on this?
We do want to set a date, and I'm gonna ask Dr. Galaviz to get with Ms. Haloma and also with AJ to see when is the soonest we can schedule a meeting for the LSG training. I'm hoping that maybe January would be a good time because it's right after the holidays. We have board members. My suggestion for the new board, whoever that may be, is that there be an extensive training for any new board member that comes on board with respect to, you know, governance issues, policies, the education code, the district policies, the board policies, and the board operating procedures, so that that individual actually goes to the LSG training having some kind of background about a board member's duties, responsibilities, privileges, and rights, and with respect to one another and the board and the district, as well as administration. So I'm hoping that the new board take that into account and institute this kind for any more new board member that comes up, is that we have a process in place to bring along these board members immediately, to get them some kind of initial training so that we can get them on board as quick as possible, and have a team building session immediately after that happens, so we can get that board together and not wait till the following summer or whatever that we have to do every year. I think we need to do it right after we indoctrinate new board members, and then have a team building session right away. So, anybody else? All right. The board.
There's two motions.
I think there's.
The motion is on the floor.
The first one was to move to March, and then Mr. Rodriguez to move forward.
Okay, let's clarify. I thought the motion was that we
Call the question.
Call the question.
There's not a motion to call the question. You don't need to do that. The motion on the floor is to move forward and schedule the LSG training, to go ahead and do that.
All
Okay.
right.
Okay.
To clarify, that is the motion to move ahead with the LSG training for all board members to attend. And we'll ask administration to give us information on the date.
Okay.
We can't hear you, Ms. Brigham. We can't hear you, Ms. Brigham. Ms. Brigham?
Yeah, I think the issue might be the speed of her connection. I had that about a month ago. There was a whole bunch of people on the line at one time at my office, and we couldn't get an internet speed going. Because I can hear her coming in, but it's choppy.
It looks like she's going to get on the phone.
Yeah, it's a lot better.
No, we can't hear her. I just hear garbling.
Might be better to take off the video and see if her voice comes in better with the reception.
All right, we appeared not to be able to have connection with Ms. Brigham. All right, we will let her make a comment if she wants after. Let's go ahead and pull the board.
Okay, Ms. Brigham?
She's on the phone. She has no communication.
Okay, all right.
Mr. Coronado?
Yes.
Ms. Brigham can vote yes or no. Yes by raising one hand, no by raising two hands. I mean, we can see her.
Okay, yes. Mr. Payan?
Yes.
Mr. Rodriguez?
Yes.
Ms. Searles?
Yes.
Ms. Straub?
Yes,
Motion passes.
thank you.
Is Ms. Brigham, I don't see her picture still on either, right? I don't see.
I can see her. I just can't hear her.
Ms. Brigham, if you will, the question, the board was being polled. You're the only one left to vote. If you vote yay, raise your hand. Okay, so that's a yes for Ms. Brigham. All right, that takes us to the next agenda item.
Item 5, consent agenda.
I move to approve the consent agenda.
I'll second that.
Just wait, Mr. Chair.
Dr. Galaviz?
Administration would like to pull 5A9.
Okay,
Okay.
Because we,
Then,
for the
Mr.
same
Chair, I
price.
move
Go ahead. Sorry,
to
Mr. Anderson.
approve the consent agenda as written with the exception of 5A9.
all right. And who seconded that?
I do. I
All
second.
right. Okay, so we have a new motion before the board for approval of the consent agenda with the exception of item A9. Okay. Is that all, administration, that you want to pull?
Yes, sir.
All right. Pull the board, please.
Okay. Ms. Brigham? Still not on?
Just raise your hand, Ms. Brigham, if you approve.
I don't see her.
Okay, go ahead and pull the
Okay.
rest.
Mr. Coronado?
Yes?
Mr. Payan?
Yes.
Mr. Rodriguez?
Yes.
Ms. Searles?
Yes.
Ms. Trump?
Yes.
Item passes.
All right. And Ms. Brigham is back on or not? Can
I
we see?
think I'm on.
All
Can you
right.
hear me?
Yes.
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 Thank God.
What is your vote on the consent agenda? On the consent agenda, it's with the exception of item A9.
Yes.
All right. All right, noted for the record. That takes us to next agenda item.
Item 6, executive session. The meeting is to be closed under Texas Government Codes, Sections 551.071, 551.072, and 551.074. Item A, discussion with legal counsel regarding status of Averlo versus CISD and mediation.
All right.
And then item B, discussion regarding apportionment and disbursement of El Paso Electric settlement funds to Canotillo ISD and appoint a fiscal agent to both receive and tender to Canotillo ISD its apportioned funds in connection with the Public Utility Commission of Texas proceeding related to the sale, transfer, or merger of El Paso Electric Company to Sun Jupiter Holding, LLC, and IIF US Holding 2 LP, entities related to JP Morgan's Infrastructure Investments Fund, PUC docket number 49849, joint report and application of El Paso Electric Company, Sun Jupiter Holdings LLC, and IIF US Holding 2 LP for regular approvals under PURA 14.101, 39.262, and 39.915.
All right.
And item C, discussion regarding replacement of trustee Iglesias to include the application process and timeline.
Okay. All right, give us the time.
The time is 5:03.
Okay. All right, board. Let's log off here and get on to the executive session portion. Does everybody have their information, their
Yes.
ID and passcode for the Zoom?
Yes.
Okay, we will see everybody in executive session. The board is now in recessed to executive session at this time. All right.
Okay, I think I'm back in, right, Stephanie?
Yes.
And you can hear me?
Yes.
God, that was so frustrating. Oh, here's Steve. Okay, I'm in good company. I'm just sitting right here.
Can you all hear me?
Yes, ma'am.
I
Hello.
can hear you. I can hear you, Miss Searles.
I put the wrong numbers in and think I joined the wrong meeting. So I'm glad I'm back here.
Well, I'm glad you're back too. I'm glad you can hear me.
Yes, I can hear you. I heard Dr. Galavis too. Are we the only ones present?
No, and Stephanie Camacho's with us. Hello. And
Hello,
then,
Stephanie Camacho.
Hello.
and Dr. Galavis, and then Steve was there, but
I'm
he's
here.
around. Yep, he's here. God, it's so cold outside. Oof. Sergio.
Yes. I just want. Annette, can you hear me?
Yes, I can. Yes, I can.
Maybe not Miss Strout.
Is just you and I, or is everybody on?
Yeah,
Hi,
Steve's
Sergio.
there.
I'm here.
Okay, Lori.
Lori's there.
Okay,
Dr. Galavis is there.
Okay. So
Miss
Blanca,
Trout.
I don't see Blanca yet.
Mr. Payan is there. Mr. Rodriguez is there.
Yeah.
Yeah, I just don't see Mondo. Oh, yes, he is. He's there. Oh, I don't see Blanca. That's who it is.
Sergio, can you hear me?
There's Blanca.
Oh,
There she is.
Thank you, everyone. I'm going to join in the phone because something happened in the computer system just now.
Okay, that's fine.
Thank you. Appreciate that. Thank you.
Okay, so everybody's back then? All right. Stephanie, would you please give us a time?
Yes, the time is 6:13.
Okay. The board at this time now has concluded the executive session, agenda items 6A, B, and C. So let's go on to next agenda item.
Item 7, new business. A, discussion and possible action regarding resolution of Arevalo versus CISD.
Okay.
Thank you. This is Steve Blanco, legal counsel for the district. I gave you an update on the status of this lawsuit that is currently pending. It's been a request from the insurance carrier, and it's a recommendation of the administration that the board allow the insurance carrier to attempt to resolve the lawsuit through a settlement using any remaining deductible that the district still has on its self-insured retention.
All right.
I move to approve that.
Well, I move to approve.
Okay.
Whatever it was taken back.
There's already a motion by Ms. Brigham.
Second.
Okay, I second.
All right.
Okay, so Brigham and Trout.
All right, so we have a motion before the board to give the remainder of the deductible under the insurance policy of the district in regards to this case, so that the insurance company may try to resolve the matter at their discretion. Is that correct, Steve?
Yes, sir.
Yes.
Okay. All right. So we have a motion and a second. Please pull the board, Stephanie.
Okay, Ms. Brigham.
Yes.
Mr. Coronado.
Yes.
Mr. Payan.
Yes.
Mr. Rodriguez.
Yes.
Ms. Searles,
Yes.
Trout,
Yes.
passes.
All right. Motion passes. Next agenda item.
Item B, discussion and possible action to approve apportionment and disbursement of El Paso Electric settlement funds to Canotio ISD and appoint fiscal agent to both receive to Canotio ISD its apportioned funds in connection with the Public Utility Commission of Texas.
Stephanie,
Bill?
we're not hearing you on some of those, some of the words you're using.
It keeps going in and out.
Yes.
Yeah, you keep kind of like fading. So if you get closer to the microphone.
Okay, sorry. Let me start over.
Okay.
Discussion and possible action to approve apportionment and disbursement of El Paso Electric settlement funds to Canotio ISD and appoint a fiscal agent to both receive and tender to Canotio ISD its apportioned funds in connection with the Public Utility Commission of Texas. Proceeding related to the sale, transfer, or merger of El Paso Electric Company to Sun Jupiter Holdings LLC and IIF US Holdings 2 LP, entities related to JP Morgan's Infrastructure Investment Fund, PUC Doc number 49849, joint report and application of El Paso Electric Company, Sun Jupiter Holdings LLC, and IIF US Holdings 2 LP for regulatory approval under PURA 14.101, 39.262, and 39.915.
So
right.
moved, Mr. Chair.
I second it.
We have a motion. Go ahead, Steve.
President Coronado, if I could, I want to make sure that the board understands we're recommending, obviously, administration and legal counsel that we approve this item, but we have a particular form of motion that I want to read into the record.
Okay, go ahead.
For the purposes of the minutes. And the motion that will need to be made by a board member is to approve the El Paso Independent School District to be the fiscal agent for the receipt of the settlement proceeds in the matter on behalf of the Rate 41 group, including the Canotio Independent School District. And I move that the board approve the division of the proceeds to the Canotio Independent School District according to the previously approved Rate 41 usage percentages used as the basis for the allocation of attorney's fees for the Rate 41 group in the matter.
So moved.
I second.
Second.
All right, would the first off, with the two board members that first made the motion and second withdraw your motion?
I withdraw my motion, Mr. Chair.
I withdraw my second,
All
Mr.
right,
Chair.
I'll entertain a motion now as indicated by Steve.
So moved.
And
All right. We have a motion by
second.
Ms. Searles and seconded by Ms.
Second.
Brigham.
Yes.
Okay, all right,
Searles and Brigham?
Yes.
yes,
Okay.
all right,
Ms. Brigham,
Yes.
Mr. Coronado,
yes,
Mr. Payan,
Yes.
Mr. Rodriguez,
Yes.
Ms. Searles,
Yes.
and Ms. Trout.
yes.
Motion passes. Okay.
all right. Next agenda item.
Item C, discussion and possible action regarding replacement of trustee Iglesias to include the application process and timeline.
All right, so the board has discussed this item and I think because that there's an election pending, that the board may want to consider those people that are on the ballot that may not make the that may not win in the election the first 4 spots and may consider appointing the next, I guess would be the purposes the runner-up, which would be the 5th position. But I think the board feels that the board new board would make that decision. So we're considering that the board place an item on the agenda on the date of the canvassing and I guess investiture of the new board at that meeting, when the votes are canvassed, and have the new board members take the oath and sit at that meeting and discuss the item. Is that correct, board?
Yes.
Yes.
All right.
Yes.
Okay. Okay, then the board then will discuss that process. Do I have a motion from the board at this time on this agenda item?
I so move.
I move.
All
I'll
right,
second Mr. Payon's motion.
all right.
No,
we
I
have
didn't
a-
move. I made a motion. Blanca Trout.
Okay,
I'm sorry, who,
I think Mr. Payan was the one that made the motion.
and who
Yes.
second?
Okay,
Ms. Searles.
okay.
Ms. Searles. Okay.
Yes.
All right, for the record, the motion is to place an item on the agenda at the meeting of the canvassing of the votes after the election of November 3rd to discuss the process and of the filling of the vacancy on the board that was vacated by Ms. Iglesias.
Agreed.
All right. Any
Okay.
further discussion from the board? Hearing none? Let's poll the board. Stephanie?
Okay. Ms. Brigham,
Yes.
Mr. Coronado,
Yes?
Mr. Payan,
Yes.
Mr. Rodriguez,
Yes.
Ms. Searles,
Yes.
Ms. Trout.
Yes.
Motion passes.
All right, that takes us to agenda item 8.
Adjournment. It is now 6:21.
All right, we are, by unanimous consent of the board, we are adjourned. Thank you, everybody, for participating, and everybody stay safe. It is very cold outside. It's 34 degrees.
Oh, my goodness. Well, everybody take care.
That means
Good
it's
night.
gonna be really cold tonight.
Yep.
Take care. Put your pets and plants in.
All right,
Good
everybody.
night. Take
Sergio for
care.
a nice meeting.
Thank you,
Thank
board.
you.
Thank you,
Board members.
administration. Thank you, board and administration. We will see everybody in a few weeks. So everybody,
Thank you.
take care. Have a nice weekend.
Take
Good
care.
night.
Take care.
Good night.
Good night.